Hello. Mental Health Awareness Week is from the 18th to the 25th of May this year. The Mental Health Foundation chose kindness as its theme because, and I quote, of its singular ability to unlock our shared humanity. Kindness strengthens relationships, develops communities, and deepens solidarity. The theme was changed from sleep to kindness due to the coronavirus, and sleep is going to feature in a future Mental Health Awareness Week. On the Mental Health Foundation website, Mark Rowland, the Chief Executive, wrote that it's probably the most important mental health awareness weeks that they've hosted. He said that protecting our mental health is going to be vital in helping us cope with and get through the coronavirus pandemic, and that the psychological and social effects of the coronavirus are going to outlast the physical ones. He said, at a time like this, the idea of kindness, compassion and solidarity seems so important to all of us and to what will get us through these challenging days. Acts of kindness can improve our mental well-being, whether we're giving or receiving it. Kindness is an antidote to isolation and creates a sense of belonging. It reduces stress, brings fresh perspective, and deepens friendships. Kindness can even improve feelings of confidence and optimism. There have been many examples of kindness at this challenging time for all of us. In local neighbourhoods across the country, people are supporting each other, doing shopping for the elderly or people who are shielding or self-isolating. People are giving to food banks and making meals for frontline NHS staff. The Clap for Carers every Thursday is a wonderful time for people to show their appreciation and thanks to the NHS and other key workers, and also to catch up with other neighbours and check in on how they're doing. I'm very proud of my 5-year-old friend Ellie, who is raising money for her local hospital. Every Saturday for the next 4 weeks, she will be doing a 2.5 kilometre run, a 2 kilometre bike ride, plus a 0.5 kilometre roller skating. Note, she's 5 years old. GP Hyder Ali in Manchester was devastated when some of his colleagues died, and he wanted to do more to help. First of all, he went to the local hotels that were putting up NHS staff and said to the people who worked in the hotels if they wanted a confidential chat or support, he'd be willing to give that to them. And then he thought, well, what can he do for the staff who were in the hotels, and sorted out goodie bags and asked lots of different companies to donate. And he's been overwhelmed by the response and also the thankfulness from the NHS staff who have felt the kindness of others. Kind people are those who go out of their way to make life better for others, and they put themselves in other people's shoes and makes them think, how can I make them happier? Kindness is not about how you feel, but what you do. The book of the Proverbs of King Solomon and Sayings of the Wise was written between 971 and 686 BC. 7 of the Proverbs are about kindness, and I'll quote 3 of them. A kind-hearted woman gains honour, but ruthless men gain only wealth. Anxiety weighs down the heart, but a kind word cheers it up. Whoever is kind to the poor lends to the Lord, and he will reward them for what they have done. Anne Frank said, you can always give something, even if it is only kindness. In the book of Joel in the Bible, it says, return to the Lord your God, for he is gracious and merciful, slow to anger, and of great kindness. Princess Diana said, carry out a random act of kindness with no expectation of reward, safe in the knowledge that one day someone might do the same for you. Aristotle defines kindness as helpfulness towards someone in need, not in return for anything, nor for the advantage of the helper himself, but for that of the person helped. The very well-known story that Jesus told about the Good Samaritan is all about being kind to our neighbours, including those who would naturally be our enemies. And one of the 9 fruits of the Spirit that St. Paul listed in the New Testament was kindness. While preparing this talk, I looked on the internet and found quite a lot of sites dedicated to kindness. I will put the details down underneath the video, but here are some of them. randomactsofkindness.org. The strapline is "Make kindness the norm." kindnessuk.org is an independent not-for-profit organisation with the goal of making kindness a greater part of everyone's daily lives and increasing the awareness of the positive benefits of kindness to health and the overall well-being of society. kindness.org.uk is research into kindness, and it says that kindness is the glue that binds every human community together. kindnessmatters.org is a campaign designed to improve the way all people interact with each other, and it's in honour of the 13-year-old Peyton A. James, who took his life after years of being bullied. It states that not everybody is a bully, but everyone can be kinder to those around them. On the British Red Cross First Aid Champions website, it says that the resources on the site will help people teach children and young people first aid, and the toolkit explores kindness, keeping safe and well-being, and it gives children and young people the confidence to help others. A girl called Georgia speaks on a video and says, "Hi, I'm Georgia. It's very easy to get lost in our own thoughts and feelings and forget how others might be feeling. Kindness doesn't cost anything and does so much good. By encouraging and supporting others to try something new or to get through difficult times, we can feel safer and happier together. Be kind and stay safe." That could be written for today, couldn't it? Here are a couple of fun facts about kindness. Leonardo da Vinci loved animals so much that he used to buy caged animals at the market just to set them free. And in 2002, Kenyan Maasai tribes donated 14 cows to the US to help with the aftermath of 9/11. Back to the Mental Health Foundation. They say, no act of kindness is ever wasted. Please join us this Mental Health Awareness Week and make kindness matter. Thank you for listening. I'm Dr. Beth Colby. Bye-bye.